Fresh off his State of the State address, the governor is live in studio to take our questions and yours to talk about legislative priorities for 2026. Spotlight Now starts now.
You're watching Spotlight Now with Ryan Kalei-Suchi and Yunji Denise on Hawaii News Now. Have questions or comments for our guests? Join the conversation in our Facebook live stream. Spotlight Now, where Hawaii comes to talk.
Aloha and welcome to Spotlight Now here on Hawaii News Now. I'm Yunji Denise. Of course, you'll notice that Ryan Kalei-Suchi is not in the studio today. He is out on assignment, but he will be back next week. For now, we are joined with our first guest, the governor of the great state of Hawaii. Governor Josh Green is joining us live. Thank you for being here, Governor.
Thank you.
We want to talk about a lot of the items you talked about yesterday in State of the State. One of the things that struck me is that you led with a moment of silence for what all has been happening in Minneapolis. And today, I understand you were just at a rally earlier today at the state capitol put on by the ACLU to talk about immigration enforcement. How are you thinking about this moment in American history?
I'm thinking about it as a dad might, which is that it's tragic to see people hurt or killed. It's not what America is supposed to be. As a governor, I worry about everyone as though they're family in our state, and it's hard to fathom that that's where we are landing. I think there has to be a de-escalation of the violence. I mean, I'm heartsick that that man and woman died at the hands of ICE enforcement. It should have never happened. We can agree to have differences in America, but there's no way on earth that it should come to gun violence. And frankly, it's really unconscionable. So I was just really heartened to see, the rally today. Wonderful people from many walks of life, I think led by like the ACLU and Indivisible and just a bunch of really thoughtful organizations. But, when you think about it, first, the woman that died, she was a mom, and now her kids are not going to have that mother. She was protesting, but for God's sake, they shot her in the face. And then the gentleman that died, he was an ICU nurse, intensive care unit at the Vets Center, at a veterans hospital. I mean, you got to be kidding me. So it really has gotten out of control. I know that people want to see the violence stop. I was proud, just so people know this is not political, I was proud of my governor friend who's a Republican out of Oklahoma, Governor Stitt. He spoke out and said very clearly that we have to have a new approach to ICE enforcement, and he felt that the president is getting very bad advice, and I would agree. It has to end. So the governors can be a voice of reason maybe, but I hope that the president's administration realizes that having people be this afraid and the possibility that very innocent people could be hurt is really not what America is about. And we should embrace immigrants properly. We should be thoughtful about new plans to help people become citizens if they've been in good standing. And yeah, we governors will work with the federal government. If there's a bad criminal out there that's also an illegal immigrant, of course we will. No one is saying that we wouldn't help there, but you can't be terrorizing our people. And that's what the rally was about. And I think it's going to mean there's going to be legislation this year. I'll be signing it, I'm sure. I'll wait to see what the details are, but they made a lot of good points today in that rally, and I was proud of people.
Well, my understanding is that there's a couple of items on the agenda when it comes to illegal immigration and putting some guardrails up around ICE enforcement in the islands. And one of them is this idea of the no secret police, that you cannot be a law enforcement officer in the state of Hawaii and doing, other than, of course, a medical mask, having what we see as the gaiters and the glasses and hiding your face. Is that something that you would sign?
Yes, I would. I think that, and I said this today at the rally, the idea that anyone has to wear a mask to cover up their identity while they're, enforcing the rule of law, it's counterintuitive. It just doesn't make any sense. It doesn't pass the smell test. So that should not be allowed. And frankly, I think hiding behind a mask emboldens people to do sometimes terrible things. There's not just the fact that they shot two people, but I've seen people kicked violently, terribly injured. We know that individuals have been getting picked up and then ended up in detention centers and dying in those facilities. I mean, there's just a lot wrong with this picture. And so I think there should be no masks.
I want to ask you also about the sensitive places. Recently, I was speaking to an immigration lawyer on Maui who had told me that ICE agents had shown up to a church to target some Tongan individuals that they suspected were here illegally, were showing photographs to fellow parishioners, asking if they had seen those people. So the idea of going to a church, going to a hospital, going to a school, what are your thoughts on that? And would you sign something to try to make those safe places again?
Yes. I mean, the idea that church-going Tongans are a problem is insanity. I mean, it actually sounds surreal when you say it. Also, people, and this is the doctor in me, don't go to the hospital when they're afraid of getting picked up. And so that we've heard that in some states they've been staking out, ICE has been staking out medical facilities because everyone needs to go to the doctor at random times. Someone has a heart attack, someone has a severe infection, someone's going for their chemotherapy. Can you imagine that people then defer getting care if they have an emergency for their child because they're afraid of getting picked up? So again, it is something that I would strongly support. And what I'm not saying we should become a sanctuary city or a sanctuary state. I'm saying that we should respect the dignity of our people, that we should make sure that they don't feel traumatized, and frankly, that we focus on the right things. And that means, okay, we should have some decent immigration laws. We should make sure people integrate into society properly like my grandfather did when he became a U.S. citizen back in the 1920s as an immigrant from Europe. We should do the right things by people, but we should only be focusing these kind of ICE raids or enforcement on people that have truly done terrible things. We can give some latitude to figure that out, but by giving people the right to defend themselves, to make their case, if we're going to put resources into law enforcement at the federal level, there should be judicial review. That's just America. And so we are right now, unfortunately, going down a slippery slope where we are a less great country because of what we're doing with ICE enforcement.
So the two individuals that were shot on the continent, Renee Good and Alex Preddy, my understanding is that they were both citizens, right? And they were both acting as, without litigating what they were doing, they were documenting or perhaps taking part in sort of protecting their neighbors, let's say.
Yes.
In Alex Preddy's case, taking that video, there is the Oahu Rapid Response Coalition, which is a consortium of immigrant rights activists and also Della Al-Baladi, Representative Baladi, and some other lawmakers who are creating a network, basically, that if you see ICE activity, you could then call this hotline and people would come onto the scene and observe and be witnesses. And their argument is these are not folks who are going to be interfering with any kind of enforcement, but they will be there documenting. What are your thoughts about the dangers? Because we have seen what has happened about bearing witness to that and being part of a rapid response. I mean, is that something you would discourage citizens from doing? What are your thoughts?
Well, I think that we want to usually rely on our own local law enforcement to be helpful and protect our citizens. I do have some concerns about flooding the zone and having essentially a rally kind of pop up around an enforcement operation, only because I worry that there will be collateral damage. But we do have to protect people, and I think eyes on the scene are good. We have a lot of ways to communicate now, so I think if you're with your neighbor or your family member, you can definitely be documenting what's going on. I think that what happened in these two incidents where Renee and Alex were killed, I think there was just a lot of hate and rage going on behind the scenes that was coming from the ICE agents, and you could see it kind of spill over. The two individuals that were killed, they were definitely in a kind of protest the moment mode, appropriately though, peaceful, not hurting anybody. I don't even know that they were saying anything that was offensive, but the law enforcement ICE agents went ballistic. They were triggered, and then they acted horribly, and frankly, it appears they committed murders. And so I think that I worry if a lot of people suddenly come to a scene that you could see situations get out of control. it would be better if in advance, and this is what my Attorney General is doing and what I'm instructing, if in advance we have direct conversations with the U.S. officials, the Homeland Security people, and tell them, work with us and communicate. If you feel that there is a dangerous criminal out there that also falls into the category of an undocumented immigrant, in that circumstance, it's easier to understand that you have an operation. And we don't want anyone in the middle of any operations when there are violent criminals or someone has been dangerous. I think we can have some common sense when we do this. But the sheer volume of these operations and then bringing lots of people into the moment, that could lead to more danger. And I just want us to be careful. I'm definitely not criticizing the effort to have a network of communication, but let's remember we have elected officials, we have state representatives, we have state senators, all of whom are trying to protect their people. They can also be alerted, and then we will alert the police if we think something's going wrong.
Okay, last question on this, because I know we got a lot to talk about. This is from Jeremiah Vu on Instagram. He said, you stated that local law enforcement should focus on crime rather than federal immigration work. How do you plan to protect Hawaii's built-on-immigration identity if federal mandates begin to conflict with our state's social and economic stability?
Well, my general feeling is that is right. We should focus on our own local problems. I've been very clear. I don't think our National Guard should ever be co-opted into the effort. That's important. And so I think our officials here can work on disaster response, and they can work on security moments that we need more help on. So I have a very clear idea of how to use our local assets. My Adjutant General understands that, and he and I talk about that a lot. I also think that we have been able to communicate to a degree what our belief is, which is that members of our society, even if they are not fully legal immigrants, should have a process by which they can become legal immigrants and legal citizens because they're part of our workforce, because they are paying taxes, because they've been here a long time and they're already part of the community. So we're not participating with the feds on this. We are actually constantly sharing where we are as comfort goes, where our comfort level is, and what we want them to share with us before they do anything that's going to really rattle our community.
Let's move on to the speech yesterday and to your legislative priorities. Anyone who's been watching this program for any length of time does know that scaling back on some of these tax cuts was part of the plan and was something that you were going to be presenting to the community. Tell us a little bit about how that's going to work in terms of who is going to be impacted and how that money will be reallocated in the short term.
Sure. And in this case, words are super important, so I'll try to be very clear, right? So the way it will work, the way we are proposing it to work, and it will be totally debated and discussed at the legislature before coming to me, is not a pulling back of any tax breaks that people get from 24, 25, and 26. We have a huge tax package that's already passed, and it will be over $5 billion going back to our people, lower taxes. At 27, 8, and 9, we would simply pause the tax breaks that were going to go even deeper. So the tax breaks that people got in 2024, locked in. The tax breaks that gave people even more protection against state tax, locked in. And then the tax breaks even further, 26, locked in. And then it would just pause there. What that will do is that will bring, if it had gone year over year more and more, deeper tax cuts, that would have meant $1.8 billion would have been unavailable to us to balance the budget. I have to balance the budget legally, and I have to pay for our services like hospitals and schools, all sorts of things. So we will pause that tax break, leave everything intact through the present, through 2026. You're seeing the biggest tax cuts that we've ever had in Hawaii. And then we'll bring that $1.8 billion back to the families that need it the most for the programs that we can't fund otherwise because the feds knocked $3 billion out of our revenue by having the shutdown, by having tariffs, by decreasing tourism globally. But just to make sure that we're caring for people who have food insecurity or need housing support, or we need to, build more housing, Of that $1.8 billion, $600 million will be spent on food security programs and child support. That is important because those are the families that tend to need it the most. And it even further augments the tax breaks that we've had for people that are in the Alice family category or living at or near poverty. That's the proposal. So one more time, just to be really, really clear, we won't ratchet down any of the tax breaks. We will just pause them. So people will get this 3-year period of deep tax cuts. It also means that like the people that are at the lowest 40% of earnings will pay essentially no tax. Most of the tax breaks that are maintained on the higher, the taxes are on the higher income people. But we will not pull back from any of the tax breaks people have got. It will just pause and you will stay steady where the taxes are lower, and that will help us.
Let's get into some of those specifics. Danco 88888. This is what you get when you get Instagram questions. You get the funny Instagram names. Says, what are some ways the state will help to cover the projected $3 billion gap in federal programs like SNAP and Medicaid over the next several years? And adds, thanks for working to support our local people in times of reducing federal funding and increasing federal uncertainty. There is a lot of uncertainty. A lot of families we saw during the shutdown really relying on these programs, and even the government shutdown, for however long it was, you really saw that people were destabilized so quickly. So how do you make sure that, as this federal funding goes away, that you don't have that kind of insecurity?
It's really hard. It's one of the reasons, like, I would never talk about pausing our tax breaks on society if we didn't have to pay for the most essential services like food for people. Remember, affordability is our number one issue. Being able to afford to live in the islands. That's why we really are decreasing state tax burden a lot. So how do you fill in this gap? Well, a couple things. First off, when they just tried to block grants or changes at the federal level, just take money directly away, I speak up. I tend to speak quietly behind the scenes with the secretaries of health or of agriculture or whomever to say, wait a second. Before you make any cuts based on the principles, say that Hawaiian programs are not worthy of support, make sure you understand exactly how we view the Hawaiian community. They are 25% of our population. They are our host culture. This is not an example that you might be trying to make a point of, DEI. That is not what this is about. Not that I support their policies. I'm just saying that is actually a mistake, and we've had some success to damp down some of those cuts. There was a moment where our university was going to be cut based on the allegation that there was anti-Semitism that warranted cuts to our university. I was able to explain that was not really the case. It was actually a colonialism question, and so those dollars were replaced. But there are some things that are very hard to replace, like the Medicaid dollars, and we have to back that up, or the fact that they're taking away the benefit for the Affordable Care Act subsidies. So I put that in the budget, the $16.5 million to support the Affordable Care Act enhanced subsidy, because I don't want 10,000 people to immediately become uninsured. We're going to ask people to buy their insurance through the Affordable Care Act, and then we will backfill them with these tax breaks this year so they will get their money. That's important. Just in that 1 month when the federal government closed, we had $42 million of food insecurity, which I was able to, with enough reserves, we have $1.58 billion, $1.58 billion dollars in reserve, rainy day fund. We were prepared to take some of that money, but we had enough money at the Department of Human Services level to help. And then we actually found a mechanism through TANF, Temporary Assistance for Needy Family dollars, which ended up paying 2/3 of it, because those were families that were in deep temporary need. So it didn't end up costing us that much because we were somewhat thoughtful and creative about where we could find the money. But as the months and years go by, if they move further away from federal obligations and put pressures on the state, it's harder to find the money. I will tell you, I thought ahead about these things. And so, for example, I fought hard for the Rural Transformation Healthcare Grant. That really is good for us. We're going to get like $189 million per year to do telehealth, to do extra training for our doctors and nurses and social workers. We're going to get extra monies to do transportation or to do medical respite. So I basically was one of the people to help create that program, and it mitigates some challenges. So that money is coming to us. And also the green fee, that's found money. Admittedly, it's a fee or a tax. It's a 0.75% tax, so that people, when they come and stay at short-term rentals or hotels, they pay that, and it will go towards the environmental stuff we need. That's $126 million per year. So we have over $300 million of found money, because I anticipated that this current administration was going to pull back from some of its obligations. And we're in a better position than probably any other state, but that doesn't mean it's easy. I will tell you that I am very worried if we have a lot of people get bounced off Medicaid. I'm very worried about what that would do to our rural hospitals. We should talk probably about healthcare and how to make it more efficient if we can. But there are things that I'm doing to navigate this. But having said all of that, because the feds took $3 billion away from us through any number of policies and actions, I have to be sensible. And in the first couple of years, I line item vetoed $1.5 billion, put into the rainy day fund. So we're okay there. So the legislature can now say, well, we have options. We can pause the tax break, keep it steady and flat for those who need it the most, and then in 27, 28, and 29 have more money to pay for these programs like SNAP, like Medicaid services, like school lunches, all these things. Or if they feel we have enough money and the data shows that, which we're going to work hand in hand with the legislators, I have total respect for them. If we need to fill in a gap, we could go to the rainy day fund. It's their prerogative. I was clear yesterday during my State of the State speech and then interviews that I believe the legislature needs to make these decisions. I can guide us on our values. I can make sure we administer the government the best that we can, but they do have to make a lot of these policy calls, and they will make the policy call ultimately on whether to pause that tax break for a couple years until we get out of the woods, or to use some rainy day funds. Those are two of our best options.
Let me ask you this, though. You are governor at least for another year. You know, we know that you'll be running for a second term, and it looks like without any meaningful opposition at this point. Donald Trump has just finished his first year, so 3 more years of an administration with this agenda. How long can Hawaii afford to shore up that, $1.5 billion sounds like a lot of money, but if you're talking about $45 million just for food, just for 1 month,
yes.
Not to say healthcare, preschool, all these other subsidies that people get, and all these programs that are now starting to sort of disappear in our community. How long can we sustain this?
Well, it really completely depends on how serious the damage is that gets done. You know, we've had some other large discussions about new monies that could come to Hawaii, and that is a part of the overall discussion I have with the federal government. The leases, for example, very controversial. We want them to respect our use of the land and protection of our INA and our values here. They had proposed taking that land quickly. I put a kind of a stop to that and said, if you're going to do that, you have to be fair, environmentally sound, and it's going to cost you a lot of resources to help us do what we have to do for the country. That could bring lots of money to us. How long can we withstand these changes? Again, if there was an immediate and sudden downturn or disaster for tourism, we would not have enough revenue to sustain what we do. I don't see any reason that they would intentionally torpedo tourism or travel to Hawaii, but if a conflict broke out that was unnecessary in the Pacific, tourism and travel could really drop. We've seen drops when there were terrorist attacks. We saw challenges during COVID. If there was a bad outbreak again that we're unable to manage from the health standpoint, could be a problem. All I could tell you is about 23 and a half hours a day, somehow or other, I'm either working on it or dreaming about ways to work on it, because we have an incredible thing here in Hawaii, which is a lot of resources in general, a very thoughtful society that cares for its most vulnerable people, and I don't want to see any of that go away. We instead want to actually enhance our support for kids who are hungry. There's far too many hungry kids. We want to make sure everyone gets early education. It's a great investment, incredibly good. And we want to solve homelessness and our housing crisis. That all takes money. So I have to keep our bond rating good, which means have enough money in our savings, our rainy day fund, have enough of a balance at the end of each year. That's why I can't go into the red. If our bonds stay good, we can borrow proper amounts of money and deal with things. But we did position ourselves somewhat cleverly by getting these new sources of resources in healthcare and environment. So otherwise, those things would have been on the chopping block, you can imagine, because it would have been aspirational ideas that we would not have been able to do.
There's some questions coming in about the HMSA partnership, proposed partnership. For those who aren't familiar, One Health Hawaii is the name of the partnership. HMSA and HPH proposing what they call not a merger, but a partnership, these two entities coming together under one umbrella. I'm curious, both as a governor and yourself as a clinician, as a
Yes.
physician, what you think about this proposal.
I'm very cautious about it. I have a deep respect for the care that Hawaii Pacific Health offers and the work they do. And I also know that HMSA has kept our rates very low compared to the mainland. Not that healthcare is cheap at all, but comparatively, we are better off than most places. The challenge here is they're both very big healthcare entities. They're the big players in our market. The other big one is, of course, Queens and Hawaii Pacific Health. Those are the other top ones. And then you got Kaiser. But they're like 2 of the top 5. If they successfully merge, there are going to have to be guardrails so that we know that a couple things happen. Waste drops. And in my estimation, we do have about 40% waste in the healthcare system. I've went to 1 million lectures, talked to so many experts about this. In America, in general, we have a lot of waste, and everywhere we have a lot of waste. Pharmaceuticals are too expensive. We should do more home care. People should be allowed to pass away with hospice support rather than in the fancier hospitals when they choose to. All of those decisions can be made better, and we can save a lot of resource. It's not about money for me. It's about being able to then have the resources to get the services, pay for more doctors and nurses, okay? If they can find big savings and can invest and guarantee that they'll be investing in more healthcare services, that's a big thing. That would help to get approval. We'll talk about approval in a second. Also, if they can assure us that they're not going to undermine through their actions, even unintentionally, the critical, mission that Queens and Hawaii Health Systems Corporation, our safety net hospitals and the state level do, if they can guarantee through the process that those entities can still do their job and even have more resources, that's another checkbox that we would have to check. But there are some real serious questions. The medical community should weigh in. Patients should weigh in. There should be guarantees that people get to still have their physician in the hospital of choice. I think that they are saying that all those things are the plan. But there will have to be, real clear proposals and plans out in public. The legislature is going to do their job to first vet it. My attorney general will ultimately have to approve it, as will the insurance commissioner. That's kind of the process. And then the feds also appear to have a role to approve or not approve anything that would look like a monopoly. So it's going to take some time. These are not bad people. These, in fact, are very good people that work at Hawaii Pacific Health and HMSA. I know them well. But they're going to have to prove the case that we will have better health care and probably savings in order to do it.
I am curious, though, what kind of regulatory oversight you actually have, because this is not technically a merger, it is a partnership, and they're being very careful not to call it a merger. Does the state really have any authority? I mean, does Ann Lopez, can she approve or not approve this? How does that work?
Well, there is always going to be a federal question, okay? And the federal regulators, whether it is Department of Justice or the FTC, they will always take input from the states, for one. Just like when we had the discussion about the merger, and it was not an easy call at all between Hawaiian Airlines and Alaska Airlines, they asked us for our opinions, and they asked us for the guarantees that we insist on, whether it was investment or keeping certain flight routes open and so on. There are similar corollaries here with the healthcare system. So our director of health will weigh in, Ann will weigh in, our attorney general, I will weigh in directly on this one. And honestly, if a state's leadership team, and those are 3 of many, were to oppose it, I would say it's not likely that anything could go forward. Now, people can do projects together all the time. For example, one thing that I believe strongly we need to do is to simplify the delivery of healthcare. So it sounds very unsexy, administrative simplification, but if it means that you can see your doctor a couple of weeks earlier, or that there's not nearly as much overhead so we can pay for more nurses, it's great. And when the main insurer comes together with the main hospital team, Hawaii Pacific Health in this case, they can make greater, simpler rules and get rid of a lot of the prior authorizations and the extra copay needs and all of that. That's a win. And then maybe that could also be adopted by Queens or HHSC. So what I think you're seeing is, in this particular moment, Hawaii Pacific Health is acting as a change agent, and they recognize that there were problems with affordability, deep problems in the state, and they felt, I'm not trying to put words into their leadership's mouth, but they, I believe, felt that they had to seek some changes because we couldn't go on like we were. There were big losses at the insurance industry side this year because of things like the shutdown and COVID, bills coming due. That has to be fixed. If we could knock off 10, 20, or 30% of our costs in healthcare, imagine how many more scholarships that could be, through the HELP program where we're paying down people's loans, or how much more we could just pay family doctors to do screenings. So that's the goal. It's going to be complicated. I don't think it's going to be particularly quick, but what they can do is they can start working on projects to demonstrate there are savings, that the work that they do directly together between HMSA and HPH is a better model. A lot of this has been in the works for a while, just so you know. All that talk about patient-centered medical home and, kind of having a medical team and not having so much specialty care, all of that work already was meant to kind of be the big beginnings of this. But I think things are getting a little more desperate, so they're going for it.
So at this moment, do you support this partnership?
I'm neutral right now. I think it's too soon for me to support or oppose it because I haven't seen the details yet. I couldn't say yes today because I have not seen the details yet that would show me that people would have more access to health care, or that there would be, a 10% savings that we could reinvest. So I haven't seen that, and I'll have to see that, of course. And I've shared that with the people I know at these organizations. I'd have to see that and also see the guarantees that rates weren't going to suddenly spike up when there was less competition. That's where regulatory necessity would kick in. I would tell our insurance commissioner, you're not going to be authorized, at least to the extent that I can influence that as governor, you're not going to be entitled to authorize big changes to pay for this stuff. I will say this, though, Yunji, this is an interesting time because I just brought this $189 million of healthcare transformation dollars into the state each year. We have a moment where if we have a good idea, if they put the best ideas into play for a partnership or merger, call it what you will, and then I'm able to invest those monies into better electronic medical records, more training, it actually is an opportunity to really help shape a better healthcare future for Hawaii.
Okay, I want to get to a few more questions before we have to let you go. I want to ask you about the State Attorney General's investigation. There's a lot being made about $35,000 in a paper bag. Well, first off, do you know who the lawmaker is?
I don't. I do wish I did because I'm super curious about it. I have to follow the law. I can't press people for information. I will tell you that I do ask for constant updates from the Attorney General so that I know, and I'm just being utterly candid, so I know if it's anyone that is serving in my administration, which I would hold them to account immediately for. I just don't know who it is. The reason that we couldn't do the investigation much sooner, and I hope that everyone understands this, is the feds were doing their investigation. They had all of their interviews and all of their research and all of the, the transcripts of the recordings they had. They were doing that investigation. And if you have two investigations simultaneously colliding, it could mess the other up. It could have a witness that was getting ready to help testify not say anything more. So you couldn't do that. Now, on the 16th of January, the feds told my Attorney General and Lopez that they were now ready. They were at a place with their investigation. They could turn over the information and it would not disrupt their work. And it was on that day that I said, yes, please go forward. I mean, the Attorney General and I agreed immediately together. This was the time to go forward and have Van look into it. I don't know what law was broken or if a law was broken. I just don't personally know. If someone took a bag of money as a bribe, obviously a law was broken. I don't know if someone tried to make campaign donations, which would be terrible to do it that way. But if it was within whatever campaign finance rules are in existence, or if it was just a bureaucratic infraction, maybe in terrible judgment, but it may not have been a bribe. That's why you do the investigation. Because if and when you end up indicting somebody for that and convicting them for that, it's going to, of course, number one, be proper because it holds people accountable, but two, it will change their life forever. And so you don't want to falsely accuse somebody until you have the facts. I can't wait to find out. I've asked them to expedite things because I think, for one, if it was an official that's still in office, I truly don't know, but if it was someone who is a current representative or senator, then the people should know that and obviously not vote for them. They should leave office and be gone. I've constantly asked people to come forward and describe. Now they could describe to the Attorney General what happened. They'll have an opportunity. She's got her best people on it. It's very tough because I hate to see, with all that's going on the federal side, where people are scared right now of the federal government, I hate to see people lose confidence in our state government. I've spent a lot of energy trying to be crazy transparent, show people what we're actually doing, putting stuff on websites, sharing innumerable discussions with you on live television. I mean, it's something that I value, which is trust in government, because I want you guys to trust me and other elected officials when we try things like building housing or working on homelessness or whatever it is. When there is a bad apple, it erodes trust. So I hope she gets to the bottom of it fast. And as soon as she has the work done, she's instructed to share.
And what do you think the timeline realistically is on this?
I think it's this spring. I mean, I think it's now. And we're almost in February. I don't see why, with the evidence that they're getting from the federal government, they wouldn't have a gigantic head start. I assume they're going to have to do some interviews with anybody who is being accused of acting in a terrible way. But that interview or interviews should be quick. I mean, it should only be a couple people. So it would be great if that got resolved now, because frankly, it makes me sad. It makes me sad after all the hard work that a lot of people do in public service, that this kind of thing hangs over all that work. But I want to be very clear. When the Attorney General has the scoop, people will know. Another example of how we've decided to govern was, remember when the Maui wildfire occurred, like 3 days later, I asked the Attorney General to look into all the causes that she could. And people were shocked that we called that quickly for a review or an investigation. It wasn't meant to catch someone in wrongdoing. It was to make sure that we quickly could get to a safer place. That was life and death, because we had been vulnerable to a fire that killed 102 people and destroyed over 3,000 houses. We couldn't wait a year, 2 years, 3 years to get to the bottom of what would make things safer. In this case, it is terrible, but I don't think it's going to affect government in the next 3 months. So they have to do their job. They have to find out if there was someone who broke the law, and then presumably prosecute them if they broke a law. And I will tell you, the public trust is critically important because everything is built on it.
Let's get back to your speech. You spoke a lot about housing and Kauhale. There's a question from Maya Haya, 808. While the Kauhale villages have been a success, the scale of the housing crisis remains massive. Beyond these villages, how is the state planning to streamline the permitting process to ensure that the 46,000 planned affordable units actually break ground before the end of your term?
Yes. No, that's exactly the right question to ask. So we've done a couple of things. We're using emergency powers and also leaning heavily on the legislature to cut the red tape. I had a conversation with someone today where I said, what are we waiting for? Let's build along the rail. This is a place where TOD, transient oriented development, is obviously something that has been thought about for decades. I mean, the train has taken like 5,000 years to build, right? So surely we know that we want to build along the rail to make use of it. It's also big open spaces. It connects, Kapolei and Waikiki and downtown. I mean, let's get on with it. So the way to do it is to use state lands where I have some prerogative to, give the lands over to be developed properly. We are in discussions already with some entities in Japan, for example, because the Japanese government has agreed to invest $550 billion in the U.S., and I can think of no better place in the U.S. to build housing than in Hawaii. And so there's Tokyo Corporation and Daiwa House are both interested. I know that we can do a lot more on Hawaiian homelands. As you heard yesterday, we did, I think it was 2,600 leases already this year. It's immediate past year, and we're planning to get up to 7,000. That means people will hold the leases. They just have to get financing to build their home, and we have low interest loans. And I'm, very proud of Kali and his pretty aggressive work to, seek extra funds. There is a bill this year to have an increase in the conveyance tax on high expensive properties, like over $2 million, for example, to increase that cost. So for people who are quite affluent and having someone buy a $4 million, $5 million, $2.5 million house, that extra tax goes directly to DHHL so that they can build villages, affordable housing. So it's really doable. We have, we've dispositioned a ton of land and housing to go, but there's only so many, builders. And I welcome pretty much any kind of housing. I prefer affordable housing, but even if people build high-end housing, it'll move more people into the housing market. And then we're going to get up to 30 Kauhale, which is very good. That'll be over 1,000 beds for the people who are very, very dangerously vulnerable.
How much money do you think that conveyance tax could raise?
I really don't know. I mean, I know that Kali wants to generate at least $100 million. And right now, I have concerns that might not be the only mechanism that you would be able to use, because right now the housing market is a bit subdued because interest rates are so high. So there are not as many transactions. I think we have to find a lot of revenue for housing. So let's go back to the start, which is probably what's on people's minds most. I'm not going to take any of the tax relief that they've already gotten away at all. That all stays intact. What we did in 23, 24, 25, and now 26. All of those tax breaks, the proposal is to absolutely keep all those breaks. But then bringing back $1.8 billion of what would have been further tax breaks, that's the kind of money that you can use to build housing. Those monies are going to be used to build housing and deal with homelessness, pay for food, the core costs that we have. I probably add energy into that mix. We have to get to a better place on affordable energy. So that's why you do these things. It's all part of one ecosystem. If you don't do one thing, like you failed to build houses, housing prices go up, affordability is more difficult, and people leave. If you don't, if you don't keep taxes low enough, people can't afford food and living here, and they also leave. And then we don't have the workforce to generate the economy. So everything's tied together. But we have the land to build on, and we have enough tax revenue in general. If the federal government doesn't crush us, we have enough monies to do great things on housing.
I want to end our conversation where we started, which is the moment of silence, the rally that you went to today, thinking about just where we are politically in this moment. You're entering the legislative session, and so we expect some good debate to happen there. But we are at a point in our political system, especially at the national level, where it feels so polarized and frankly so confrontational.
Yes.
What do you say to the public in this moment? Because I think, whatever side you're on, seeing that death over the weekend was really, I think it really hurt a lot of people.
It did. It scared people also terribly. Some of us are trying to go the extra mile to be able to reconcile our political differences with the opposite party or the opposite ideology. I am reaching out deliberately to my conservative governor friends. I will be personally the head of the Western Governors Association with mostly Republican governors, and I will work on mental health care with them in a nonpartisan way to give them a common space to trust one another. We need that. And, this will pass. The very, very corrosive politics that exist right now amongst many at the executive branch at the federal level. That will come and go, but we will all be here as citizens, and we have to heal this country. I'm trying to extend olive branches wherever I can. It was difficult last week because two things were happening at the same time. The Department of Homeland Security had just had this terrible pair of incidents where they killed innocent Americans. And at the same time, I had to reach out to the Department of Homeland Security to secure the resources for the 1-year extension on housing on Maui. We needed that housing for 1,000 families so that they didn't suffer depression, worry that they would hurt themselves, that they would have to leave Hawaii. If I had just gone ballistic, which, believe me, inside my heart, I wanted to scream that what had just happened is completely unconscionable. So I talked to them and said, you have to de-escalate the circumstance, but I'm not just going to go on MSNBC or CNN and speak about how terrible you are. I'm going to ask you humbly to pull back from those actions, because at the same time, I'm asking them to help the people that are suffering on Maui. So it is a dynamic government. It really requires partnerships, and ultimately, of course, it requires better morals. The morals are sometimes hard to find, but the people across our country are speaking up. I did go to the rally today and spoke at the rally because I thought that was a bridge too far. So there are times where you just have to speak up, but there's a lot of times you have to try to make the peace. And the governors are about 50-50 across the country. We have to operationalize all of what we do. We are closest to the people as far as elected officials go. So it's kind of our job to try to make this country work again. There are a lot of good governors out there that will seek the presidency the next go around. I'm going to happily, if people have me, be the governor of Hawaii, till 2030. Honestly, if people just decide that. But I want to work on this kind of reconciliation in America. And it is possible. We actually convinced the Homeland Security people to give us this extension. And we've kept them more or less calm on ICE activities here in the state. Other states have not been as successful. And so people will have to try to learn from the approaches to see what's going to work in America.
Okay, well, Governor, thank you so much for being here today. We appreciate your time. We're going to be back on the other side of the break with the folks from Aloha United Way to talk about a valuable resource in our community, 211. Stay with us.
There we go.
Thank you. Welcome back to Spotlight Now here on Hawaii News Now. Time for our Community Now segment, and we are joined by Jennifer Peacher, Vice President of 211 Community Response Programs. Jennifer, thanks for being here.
Thank you for having me.
We want to touch on sort of building on what the governor had talked about, just all the need and the lack of affordability in our community. We know that 211 is a fantastic resource for so many in Hawaii. For folks who aren't familiar, what is 211?
211 is a 3-digit number that anyone in Hawaii can call to reach our anonymous helpline. We are staffed 7 days a week, every single day, even holidays, from 7 a.m. to 10 p.m. with Hawaii residents answering the calls, answering questions, and then also doing information and referral to community resources.
And what kind of calls do you typically get?
So we get calls. The calls that we get run the gamut. We have calls right now. There's a lot of uncertainty in our community, and we're getting a lot of calls from folks who are unsure about federal benefits. Our top reason for call always is housing and shelter. Second is always food, and finally utility bill assistance. So really, folks are calling us about basic survival needs.
The governor in his State of the State, and also just in our conversation earlier this hour, talked about affordability, about housing, stability in the state. Where does 211 fit into that picture?
I think that one of the things that we're able to learn in 211 is directly from community, right? 211 talks with folks in our community real time, and we collect a lot of information from the community around what the needs are. And in 2025, we took over 50,000 calls for help. And there's a tremendous amount. It is up 20% from the year before, and we are tracking and trying to kind of keep a pulse on what's happening in community so that we can help folks, our partners, right, our nonprofit partners, to better serve and help our community to better understand what the needs truly are real time.
Yeah, so when someone calls into 211, tell me a little bit about that experience and what kind of resources you can offer them.
Sure. So when somebody calls 211, they are going to reach our live local call center, and someone in your community is going to be talking with you. We are local, trauma-informed, and culturally sensitive. So, we truly are your neighbors. And what we're going to do is we're going to talk story. Tell me what's going on. Tell me how I can help. We really want to walk alongside and help folks to kind of figure out what their needs are. And then what we'll do is we'll ask 3 questions to keep it anonymous: your gender, your age, and the zip code. And that helps us to navigate our more than 4,000 resources that are in the database. And then we will usually text the resources directly to your phone.
Yeah, I think the anonymity piece is really important because, for good or bad, I think a lot of folks are embarrassed to reach out for resources, or maybe they feel like, oh, this is for somebody else. What would you say to those folks?
I would say that 211 is for everyone. I mean, we have resources for housing help. We have resources for SNAP, but we also have resources for everyday things. We had a mom call us one time who her keiki wanted to learn to ride a bike. She didn't know how to ride a bike, so both of them went and learned together through a referral that we gave them. So it truly is for everybody. In the kind of times that we're in right now, though, we really just want to help, and we really just want to walk alongside folks and be a place for folks to come where they can actually talk to someone.
50,000 calls is a tremendous amount of call volume. I'm curious, I know you have a report coming out on 211. Can you give us a little preview of what kind of data you're looking for and what we can expect from that?
Sure. From the data that we collect, we are actually able to isolate the needs in real time in our community and housing, food, and utility bill assistance are our top reasons for contacting us right now. And the 211 report, it'll be our first annual report that we're releasing, and it will have data that includes data by county, data by our top 3 zip codes that have need, and also something we call unmet needs data, which is data around when folks call us, sometimes we can't help, right? So the first thing that we're going to do is we're going to help our client to make sure that they can find a resource that will help them kind of offset costs. So let's say there is no utility bill assistance available. Then we're going to ask them, well, do you have SNAP? Can we help you with any other type of assistance to offset those costs? But we're also on the back end going to tag that as an unmet need. And what we're going to look at is it truly an unmet need, or is it just not in our database? And we do have someone on our staff whose full-time job it is to vet and validate the resources. So in our database, in our search engine, we try to have the most current and up-to-date resources available to folks. And and so what we are tracking is, what we're able to track with that data is kind of pukas in the system, right? Where are there resource deserts in our community?
Mm-hmm. And I would imagine that, we've talked a lot with the governor and other lawmakers over the last year about the changes in federal priorities and the ripple effect that has in community. What kind of changes have you seen in the calls you get and in the call volume?
So in the final quarter of 2025, we actually experienced a 70% increase in call volume, largely attributed to the government shutdown, to the uncertainty around SNAP benefits. During the week of the announcement that SNAP benefits for November might not be paid out. The day that the governor went on TV and said, hey, we want to offer our community these resources, our call volume spiked to over 1,000 calls in one day.
Wow, that's tremendous. Well, lastly, if folks do want to reach out, obviously we know the number, and it sounds like no matter what the need, you guys are there.
Absolutely. We are here 7 days a week, 7 a.m. to 10 p.m., and we truly just kind of want to walk with you in your journey and help us as best we can to connect folks with the resources that are out there.
Anonymous, local, I think that also is so key, that you'll be talking
Absolutely.
to someone from Hawaii.
You will be talking to someone from Hawaii, and we also offer interpretation in 180 languages. So if you have a need for a language interpreter, we're able to do real-time interpretation as well, so that everybody can be fully self-expressed.
Okay, Jennifer, thank you so much. The number is 211. Hey, thanks so much for joining us today on Spotlight Now. We'll be back next week to talk about the green fee. Ryan will be back, and we'll be at a new time starting next week, 12:30. Make sure to join us. Aloha.